My name is Dr. Fazah Akhtar Hanapiah. I'm an Associate Professor of Rehabilitation Medicine with UiTM. I'm here in Dehn under a secondment program from the Ministry of Higher Education, and my role in Dehn is as the President, and I'm also the person in charge who holds the license for the hospital. How is Daehan different from other rehabilitation hospitals is that we incorporate the Korean way of rehabilitation, which means that we practice rehabilitation in a very structured, very disciplined, very patient-oriented. And when patients come into Daehan as an inpatient, we give at least 3 hours of intensive rehabilitation therapy. So in a way, we are different in a sense that when patients come in, they have already targeted goals, and each of these goals is addressed by different parts or different members within our multidisciplinary team. We have a complete team here of rehab physicians, physiotherapists, occupational therapists, speech and language therapists, supported by our rehab nursing, dietitian, clinical psychologist, and we also have a strong team of visiting locums that helps conduct the rehabilitation program for our patients in Dehn. The application of regenerative medicine in rehabilitation is not something foreign. In fact, we've been practicing it ever since we started rehabilitation medicine. What is exciting now is the development of the modalities that we can apply in regenerative rehabilitation. So if you look back at the basics, even exercise is considered as regenerative because we are improving the patient's function, cardiovascular, pulmonary, to promote recovery. So that's very basic, and people don't see that as regenerative in the first instance, but it is part of regenerative rehabilitation. I would foresee that with more research coming in, more evidence coming in, we will have a better idea of how to apply regenerative medicine, especially with the bioengineering development within Malaysia and also globally. Things that were once considered impossible in terms of regeneration becomes more expedited in a sense that we will see better outcome. And we can also see that the understanding of the body's recovery with rehabilitation and augmented or supported by regenerative medicine, patient's function can be put at a higher level. So the understanding of recovery is still within the process of research. We don't know everything about it yet, but when we apply regenerative aspects of regen medicine and regenerative rehabilitation, we find that the patients undergoing these types of programs do have a better outcome. So my expectations and my hopes for rehabilitation medicine with incorporating regenerative medicine is high, and I hope that we can actually have more of these modalities given to our patients so that they become functionally better to the point where they can have that quality of life and maximize their recovery.
Cytohealth, evidence-based solution.